You know that bottle in almost every medicine cabinet? The one you probably reach for without a second thought? Well, what if that familiar pill came with a proper user manual? That's exactly what we're doing today. We're unpacking the essential guide to ibuprofen. We've all been there, right? That dull throb on your head, a fever that spikes out of nowhere, or those just nagging muscle aches after a really long day. It's a feeling we all know. And when those symptoms hit, chances are this is what you turn to. I mean, it's one of the most common over-the-counter drugs in the entire world, a true household name. So here's the game plan for our explainer today. We're going to start with what it is, then look at the science of how it actually works. After that, we'll get into the practical operating instructions, cover the really critical safety warnings, and we'll finish up with the all-important fine print. Okay, first up, the basics. Let's talk about what ibuprofen actually is and what its main jobs are inside your body. So ibuprofen, which you probably know as Advil or Motrin, belongs to a class of drugs called NSAIDs. That's a mouthful. It stands for nonsteroidal anti-inflammatory drugs. And just like the name says, it fights inflammation. But it's really a triple threat. It's an antipyretic, which is just a fancy way to say it reduces fever. It's an analgesic, meaning it relieves pain. And it's anti-inflammatory, so it brings down swelling. So how does one little pill do all of that? How does it actually stop pain and bring down a fever? Well, the science behind it is pretty fascinating. Let's dive in. To really get how ibuprofen works, you first need to know about these things called prostaglandins. Think of them as your body's built-in alarm system. When you get injured or you get sick, your body releases these chemicals right at the site, and they're the ones that signal your brain to feel pain and cause inflammation. So the process is like a chain reaction. Step 1, you have an injury or an illness. Step 2, these special little enzymes called COX enzymes get to work and start creating all those prostaglandins. And step 3, that's when you feel the results: pain, fever, and swelling. It's your body's natural response, even if it is a really unpleasant one. And this is where ibuprofen works its magic. When you take it, it basically throws up a roadblock. It inhibits those COX enzymes, telling them to stop production. Now, what's really interesting is that it blocks both COX-1 and COX-2 enzymes. Blocking COX-2, that's the good part that reduces pain and inflammation. But it also blocks COX-1, which helps protect your stomach lining. And that's exactly why long-term NSAID use can sometimes lead to stomach issues. It's a powerful but kind of blunt instrument that just turns down those alarm signals so you can finally get some relief. Okay, so we know what it is and how it works. Now for the really practical part, the operating instructions. How much should you be taking, and what can you expect? Let's look at the timeline. After you take a dose, you can generally expect to start feeling its effects within about 30 to 60 minutes. That relief then typically lasts for a good 6 to 8 hours before it wears off. Now, getting the dosage right is absolutely critical. For an adult, a typical dose is 400 to 800 milligrams every 6 to 8 hours. For kids, it's totally different. It's all based on their weight, which is about 10 milligrams per kilogram every 4 to 6 hours. But listen, the most crucial point for anyone is to never exceed the recommended dose. Okay, let's move on to maybe the most important part of any user manual, the safety warnings. Knowing when not to use ibuprofen is just as important as knowing when to use it. So let's just compare. On the left, you've got the indications, when it's okay to use. Think short-term pain, fevers, and inflammatory issues. But on the right are the contraindications, and these are really serious. You should avoid it if you have an allergy to NSAIDs, any bleeding disorders, kidney problems, or an active stomach ulcer. And hey, like any medication, there are potential side effects. While most people tolerate it just fine, it's really important to be aware of possible reactions. These can range from common things like nausea or a rash to more serious issues like bleeding, swelling, or even a severe allergic reaction. Okay, finally, let's look at the fine print. You know, these are the details that are super easy to overlook, but are absolutely essential for using ibuprofen safely and effectively. One of the most critical things to know is how ibuprofen interacts with other drugs. First rule, avoid taking it with other NSAIDs, like aspirin, because that just increases the risk. It can also interfere with really common medications for blood pressure, like ACE inhibitors and beta blockers, or with certain diuretics. This is exactly why it's so important to always talk to your doctor or pharmacist about everything you're taking. And there are special considerations, especially when it comes to pregnancy. The source material is very clear on this, so I'm going to read it directly. NSAID used in the pregnant patient should be avoided beginning at 20 weeks gestation. Prescribing information for ibuprofen specifically states to avoid use starting at 30 weeks gestation. That is a direct and very serious warning. So after going through the entire user manual, it kind of leaves us with a question, doesn't it? That simple, everyday pill sitting in your medicine cabinet, is it a bit more powerful and a lot more complex than you ever really thought?